Case Management Week is October 12th through the 16th, 2020. On this week's podcast, we're going to launch our new series on work-from-home nursing jobs with a deep dive into case management. If you would like to learn more about this rewarding career opportunity for nurses, you won't want to miss this episode. Welcome to the Stay at Home Nurse Podcast. I'm your host, Deanna Cooper Gillingham. For over 25 years, I've strived to use my nurse credentials to find work that fit my lifestyle. Whether it was raising my 4 children and 3 fur babies, traveling the world, or moving to Mexico and living on the Caribbean Sea. Sometimes I succeeded, and sometimes I failed, but I always learned from the experience. Now, I want to help you by sharing what worked and what didn't work. There are so many opportunities out there for nurses today. The Stay at Home Nurse Podcast will inspire and equip you to have a nursing career that is meaningful and supports your lifestyle. Now let's get started. Hello and welcome to this week's episode of the Stay at Home Nurse Podcast. I am so excited to be speaking on this topic, case management. I've been doing case management for quite a few years now, and I absolutely love it. And my hope with this podcast episode is that you may decide that you love it too, and it may be something that you want to move into. Okay, so let's get started with talking some nuts and bolts here. What is the salary of the case manager? According to salary.com, the average case manager salary in the United States is $80,352 as of August 27th of 2020. But the range typically falls between $73,443 and $88,015. Salary ranges can vary widely depending on many important factors. Most importantly is where you live. Geographic influences always play the biggest part on salaries. Other factors can include your education level, certifications you may have, additional skills, the number of years you have spent as a case manager, and in the medical profession in general. As far as work-from-home nurse jobs go, case management is one of the better paying. We talked about this further in episode 28 with Sadie, the remote nurse. We'll link to it in the show notes. Now there's one more thing I'd like to clarify before we go any further. Case management is not only a remote job. Many employers would like you to work on site. This could be in a hospital, this could be in an office, but there are many remote jobs for case managers. So let's move on to the next question. What do case managers do? Case managers actually follow a case management process, which is similar to the nursing process. Case managers advocate for their patients. They provide information to their patients and educate them on their disease process, medications, anything that you would normally educate your patient on. They handle transitions of care, so they may be the one coordinating the ambulance, they may be coordinating home care once a patient comes home, or if they need to go to a skilled nursing facility or an LTAC or a rehab, they would be coordinating that also. In addition, they can do utilization management. We're actually going to have another special episode just on utilization management. This is something that some case managers do and some do not, depending on their work environment. Case managers will make phone calls to clients, doctors, clinics, and they'll coordinate DME. And when there's a problem, they will fix it. They'll look for alternative resources for patients who maybe have a plan benefit that doesn't cover something that they need. They will provide education and support to caregivers that may be taking a patient home for the first time and have no knowledge on how to take care of this patient, what their needs are going to be. And a lot of what the case manager does is very dependent on the setting in which they're working in. Okay. So, what kind of clients do case managers work with? Normally, case managers work with clients who have severe needs. They're not your normal patient who's just coming in for a total hip replacement or a total knee replacement, but they may have complex discharge planning. They may have other comorbidities that make it difficult for them to recover. They may have no support system or very poor support system so that they may not be able to go home. They can also work with patients that have very complex medical conditions, such as patients that need a transplant, patients that have a new diagnosis of a cancer, patients that had a traumatic brain injury or a multi-trauma. They can help patients who have complex discharge needs. They also may follow patients who have high-dollar diagnoses. So an insurance company may pay a case manager to manage this patient that has a high-dollar diagnosis to try to bring the cost of that diagnosis down. Also, patients that have a lengthy recovery, a complex treatment plan, maybe some behavioral health issues. Case managers can handle patients of all age ranges, from preterm infants all the way through to geriatric patients. They can also specialize in high-risk pregnancies, and workers' compensation case managers help injured workers. So as you can see, just about any patient population can be helped by a case manager. When I worked in case management, we had a special department that handled transplant, we had a department that handled behavioral health issues, and we had a department for mother-baby. The types of cases I handled came anywhere from stroke to cancer to traumatic brain injury, non-healing wounds. It ran the gamut. We really had patients all over the place, and I loved that because I always had something new that I was learning about. I wasn't doing the same thing every day, which I really loved. Okay, moving on to the next topic. Where can nurses find work-from-home job opportunities? Large national insurance companies are probably the most popular, but because of that, they can be some of the hardest to get into. For every one job opening that they have, they are now receiving almost 300 applications. But that's okay. You don't have to work for a large national insurance company to work from home as a case manager. Other places that hire case managers to work from home include government agencies, such as local agencies, regional agencies, state and federal governments. They may hire case managers to help patients that are disabled, people on Medicaid, people with developmental disabilities, special needs children, or the elderly. Every geographical area is different in the types of clients that they would hire case managers to help, so you'll really need to check out what's available in your area. Also, hospital systems, especially large hospital systems. Some of them will have a case management department that works remotely where they will call clients after they go home, especially clients that are more high risk for readmission. One of the things that Medicare does is they ding hospitals if they have a readmission within 30 days of a discharge for any reason on a Medicare patient. So making sure that the patients have what they need, making sure that they got their prescriptions covered, that the DME that they ordered has actually come, that they know how to use the DME and that they are using it properly. If home health was ordered, that they are actually showing up. If they have doctor's appointments to follow up on, making sure they have transportation to these doctor's appointments. These are all things that can be done to prevent a rehospitalization and save the hospital money. Also, workers' compensation is a very popular place for work-from-home nurses to work as a case manager. Some of these case managers will work solely telephonically from home, but others will actually go out in the field, as they call it, and they will attend doctor's appointments with the injured worker. Some people actually prefer this as to working solely from home because there is a downside, believe it or not, to working from home. You are stuck in your office, which is usually a spare bedroom or something, for 8 hours a day. So a lot of people actually like the flexibility of doing the workers' compensation field case management because they can go out into the community and they can meet with people and have conversations, and they meet with the doctors and the office staff. So they like that. And of course, the injured worker. Okay, another place that hires case managers to work remotely is other insurance companies, such as auto insurance and homeowners insurance. Auto insurance accidents could be catastrophic, and it's not covered under the medical insurance plan. It's covered under the auto insurance plan, and they will hire case managers to take care of clients who have complex medical need post a car accident. Also, think of people that fell off their roof when they were re-roofing their house or something like that. They could have a spinal cord injury or a traumatic brain injury and need case management to help follow them and help to get them back to as close to normal as they can get. I failed to mention earlier, that is one of the jobs of the case managers, to help to get the patient back to normal or to help them to find their new normal. Okay, and one more place that I'm going to mention that would hire work-from-home case managers is large corporations. For example, Apple, they have a case management department so that if a worker is unable to work, they actually have case managers that will follow them. And think about it, this is a great value add for a company, a large corporation who maybe their employers are not working up to their full potential because they have a sick child at home or a sick spouse or a parent that's sick. Having case managers at the corporation that can help with this and follow up means that that employee is better able to do their job because they're not making phone calls on the side and waiting for doctors to call back and all of those types of things. Okay, this is just a short list of some of the places that would hire work-from-home case managers. There are many more out there. And actually, the more obscure it is, the better chance that you'd get hired for that job because there won't be as many people applying for it. There are also case managers that start their own business. They are in independent practice, and they can work with any type of patient that they choose to work with. So what kind of qualifications do you need to be a case manager? Most places that hire case managers want you to have some recent acute care experience. Usually 5 years is the recommended amount, but I know people that have gotten hired as case managers with as little as 1 year of experience if they've had good experience, and depending on what other experience they bring to the table, other things that they've done in the past, other degrees that they may have, other places that they may have worked, that would be a value add for a company. In addition to experience, you need to have a license or degree that allows you to perform an independent assessment. Registered nurses have this license. But case management is not limited to nursing. Social workers work as case managers, physical therapists, occupational therapists, speech therapists, respiratory therapists, and many others. Another qualification many employers would like is CCM certification, especially for work-from-home case management. This seems to be the most coveted certification for work from home. Now, the catch-22 is you have to actually work as a case manager for 1 to 2 years before you're even eligible to sit for the CCM. But many employers, if they see that you have another certification, will be more willing to take a chance on you knowing that you have passed a certification in the past and that you will be more likely to be able to pass the CCM certification. Also, this is not required by all employers, but I think at the present time about 50% of employers of case managers are requiring CCM certification within about 5 years of hire. Some, but not all, employers are looking for a BSN. Now, all of these qualifications are what I would like to say fluid. It really depends on the employer and what they want. I worked as a case manager with an associate degree, but I had about 15 years of experience in a variety of settings before I became a case manager. In addition to qualifications, there are also some skills that make a good case manager. And sometimes if you don't have all of the qualifications, but you have some skills and you can really expound on those, they can kind of fill in some gaps. So we're going to go over a few of the skills here that make a great case manager. Number 1 is excellent communication skills. You have to be a great listener, especially if you're working remotely and over the phone. You have to be able to read between the lines and be able to really understand what's going on by tone of voice, the way people pause, what's going on in the background. And you have to be able to communicate really well and really quickly, especially when you're making that initial phone call to try to get somebody to go along with case management. You have to kind of sell yourself, and you have to be able to communicate very quickly the value that you're going to provide to them. Next, you need strong computer skills. These are things like knowing how to use Word, Excel, email, have attachments, open up a PDF, use programs, access medical health records, do a basic Google search. All of these things come in really handy. If you are afraid to touch anything on a computer or afraid to click a button on a computer, it would be very hard for you to become a case manager. You're going to have multiple tabs open that you're going to be going through from one to the other. You need to know how to copy and paste. You need to know how to do all of this quickly. Okay, next, knowledge of reimbursement methods. As a nurse, we don't really care if our patient has insurance, what insurance they have, if it's good insurance, if it's bad insurance. As a case manager, this is your world. Knowing what insurance covers, what things are not covered with insurance, knowing about deductibles and co-pays and all of these types of things, what Medicare covers, about the 2 midnight rule, and what is considered an inpatient, and what is considered an outpatient. So if you have a knowledge of these going in, that puts you way ahead of the game. Now, that's not to be said that you can't learn these things. It's just there is a steep learning curve, so the more of this that you understand beforehand, the better off you'll be. Next is you need to be knowledgeable of resources that are available, community resources, financial resources, medical resources for the clients that you'll be serving. Next, you need to have an understanding of the social determinants of health and how they impact your clients and their ability to reach their goals. Having some skills and understanding of patient coaching and motivational interviewing is also very helpful. That's something that's used a lot in case management. Another skill is organizational skills. You need to be able to find resources quickly, so when you find something and you like it, you need to be able to organize it so you can find it again. You also need to be able to multitask and go between one thing and another while you're calling one doctor's office and you're leaving a message, and then you're calling a DME company, and then that first doctor's office is calling you back. So you need to be able to switch quickly from different tasks. That goes along with prioritizing. You need to be able to prioritize your day and know what's most important to get done, because some days everything won't be getting done, but you have to make sure that the most important things are getting done. Time management skills. You have to be able to do things quickly and efficiently. You need to be a problem solver. You will be the person everybody comes to when there's a problem to be solved. When they can't discharge a patient because there's nowhere for them to go, they're going to come to you. When the family isn't ready to take the patient home, they're going to come to you. When the doctor needs something, they're going to come to you. Everybody's going to come to you, and you're going to be the person who is supposed to solve all of the problems. That can lead to critical thinking. You have to have good critical thinking skills, which as a nurse you already are. Also, a good negotiator. Sometimes you have to negotiate, and I'm not talking about just money things. I'm talking about negotiating an extra day for a patient who doesn't have a ride home, or negotiating a patient into a rehab that maybe doesn't quite meet the qualifications. All kinds of negotiation that's going on there. Negotiation with patients to go to a SNF versus going home because they're really not ready to go home. Interview skills, you have to be able to interview your clients and actually get information out of them that is important. You have to be able to research. Google is your friend. And you need persistence, because you will have to really push and fight for your patients as a patient advocate, as we talked about earlier. A patient advocate is the one who will fight for their patients, and you need to be persistent, and you need to be aggressive about going after what your patient needs. Okay, closely related to skills is qualities and traits. And qualities and traits that make a good case manager include adaptability and flexibility. Things will be constantly changing, and you have to be okay with that. You need to be an independent worker, but you need to know when to ask for help. There's nobody, especially when you're working from home, telling you what to do. They're just looking at your outcomes. They don't really care how you got there. They want to know that you were able to get the outcomes that were needed. And so you better be able to work on your own without somebody telling you what to do. You need to have strong ethics, values, integrity, and trust. You are with people at their most vulnerable times, and you need to really be able to want to help them, be able to help them, and you have to be doing that in the most ethical of ways. You also have to have compassion. A lot of times people need someone to talk to before they're willing to open up. So sometimes you just need to listen and show compassion before you can move forward. You need to be approachable. You need to be the type of person that people come to when they need help or when they have a question, because that is your job, is to solve those problems. Personal development, somebody who's always trying to get better and grow, because you're always going to be learning about new things, changes in Medicare, changes in reimbursement, changes in maybe a treatment plan. You have to have patience, because you're often waiting on other people to get back to you. And as we talked, you have to have a little bit of assertiveness, especially when it comes to your patients. It's kind of like with your children, you can be the mama bear. You kind of need to be that way with your patients too. You have to have common sense. You have to have curiosity, and you have to be a good networker. You have to be able to go out there and find resources that are available for your patients. And sometimes that means you just need to talk to a lot of people and connect people, and then they connect you to the right people when you need it. And finally, you have to be a good collaborator. Although you're an independent worker, in that you have to be able to be self-motivated and know what you need to get done and when you need to get it done by, you also need to work with doctors, nurses, insurance companies, DME companies, home care companies, rehabs, skilled nursing facilities. So you need to be really willing to collaborate with these people to make sure that the patient gets what they need. Okay, moving on. So what type of nurse is this a good fit for? Nurses who still want patient interaction. You have to love patients. If you're a nurse who is tired of working at the bedside and just quite frankly burn out with patients, this is not a good career move for you, because you still have to deal with patients. You still have to deal with physicians. You're just dealing with them on another level. But if you're looking for a job that is work from home, where you still have interactions with patients and you can still make a major impact on their lives, this is for you. Also, this is good for you if you have strong computer skills. If you're not afraid of the computer, if you're experienced with working with electronic medical records, this would be a great fit for you. Somebody who has strong communication skills. You really replace your stethoscope with a telephone and a computer. So if you have strong communication skills, you're easily able to do that. So who is this not good for? This is not good for somebody who would rather deal with a computer than a patient. Yes, you will be dealing with a computer, and it is an important part, but you will still be dealing a lot with a patient. So if you don't have that desire, if you're really burned out, this is not for you. If you don't like talking on the phone, this is not for you. You'll spend a lot of time talking on the phone to reach your clients and other members of the healthcare team, as well as DME companies and other collaborators. Now, if you're thinking case management is for you, what can you do next? Here's a few things. Join the professional organization, CMSA, the Case Management Society of America, or at least check out a few of the local meetings around you. Another thing you can do is check out our webinar. We have a webinar at thecasemagementinstitute.com. So if you go to thecasemagementinstitute.com and you click on the button that says, I want to learn more about case management, we have a webinar there that you can watch. It's an hour long, and you can get 1 CE credit for nursing. We're actually applying for that now, so hopefully by the time this airs, we will have it. And you can actually earn 1 CE credit for nursing to learn about case management, utilization management, what the difference is, and which one may be better for you as a career option. We will have a link to that also in the show notes. If you are truly committed and you know that case management is for you, you can take our course. We actually have 2 courses. One is Foundations of Case Management, and you can get 15.5 nursing CEs for that. And then we also have a Foundations of Case Management with Utilization Management and MCG. This is the ultimate course, as it teaches you everything that you need, including utilization management, and how to use MCG software, which we will talk about more on next week's episode when we talk about utilization management. Both of these courses will teach you the case management process. They'll also teach you reimbursement methods and insurance principles, probably one of the hardest things to learn on the job. They'll also cover the case management standards of practice, ethical and legal standards that case managers should be aware of. They'll handle levels of care, the utilization management process, how to advocate for your client self-advocacy, self-care management, client adherence, client empowerment, client engagement, client activation, all of these buzzwords that are floating around in the case management industry, and adherence to care regimes. In addition, you'll be taught behavioral change theories and stages of change that allow you to assess the client and develop a plan of care based on the client's stage of readiness. This course is an on-demand course, meaning you can take it from the comfort of your own home any time of the day or night. You can re-watch lessons if you like. They're actually multimedia, so you have a video that you can watch with a PowerPoint. You have an audio if you'd rather just listen, and there's a PDF so you can read along. And then there's some bonus materials that you can actually watch. In addition, you have access to an instructor. There are assignments with this course, and your instructor will read over the assignments, making sure that you are getting it. These instructors love case management, and they are as committed to your success as you are. Because Case Management Week is coming up October 12th through the 16th, we're having a special promotion for a limited time. Each of our courses on case management, the Foundations of Case Management, the Utilization Management course, and the combined Foundations of Case Management and Utilization Management course are each 15% off. And in addition to the 15% off, we're doing something that we have never done before. We're allowing that 15% off to be combined with a promo code. As a listener to the Stay at Home Nurse podcast, we want to thank you. So we are offering you an additional 10% off. That's right. You'll get the 15% discount off the normal price, plus an additional 10% when you use the coupon code TSAHN10. That's the Stay at Home Nurse, TSAHN10. We're using just lowercase letters for that promotion, so it's the letter TSAHN10. That will get you 10% off in addition to the 15% off. As I said, this is for a limited time. We know podcasts last forever, and you may be listening to this after October of 2020. So, if that's the case, as a listener of the Stay at Home Nurse podcast, we are going to give you the chance to get 20% off. Use the coupon code TSAHN20. Again, all lowercase, if you are coming in after our promotion has already expired, and you'll be able to get 20% off the regular price. If you have a friend or a colleague that you think would be a great fit for case management, share this podcast with them. Let them know we're having a sale, and this would be a great time for them to learn more about case management. Also, Don't forget to check out our webinar if you need more information. Again, we're going to have links to all of these in the show notes, as well as the coupon code so you don't have to stop and write it down. Okay, that's a wrap for this week's episode. I hope you have enjoyed listening to me talk about case management as much as I have enjoyed it. Again, I love case management. It is a wonderful career option for nurses. You won't want to miss us next week when we talk about utilization management, another great career option for nurses who want to work from home. So to make sure that you don't miss the episode, make sure you hit the subscribe button on your favorite podcast player or go to thestayathomenurse.com and subscribe to our newsletter, and then we'll send you an email reminder when the next episode is out. Adios from beautiful Puerto Aventuras, Mexico. Until next week.